Hi, good day, everybody. Thank you again for joining me on the Pulse Point. My name is Dr. Gina Weeks, and today we are joined by Dr. Brandon Dominguez, who is our Director of Simulation and Lab at the School of Nursing. And I wanted to bring him on today, as I promised from the last podcast, to kind of talk about our Learning Lab, which is really central to our student success here in the program, and kind of talk about how faculty can get involved in the Learning Lab and what they can kind of expect when they are there. So thank you so much for joining me today.
Thanks for having me. And when most people think about like a learning lab, they're like, what is that? Like, what do you mean a learning lab at a school of nursing? So I'm excited to share a little bit about what it is. And I always tell people that are interested in joining our team that it's kind of like a library, but with a practical side of like what nursing is all about. So being able to have not just a study space for students, but an actual space for students to practice those hands-on practical skills for that. So we have so many great things here in our learning lab, and being able to offer that equipment to the students and for the faculty members, even sometimes practice and sharpen their own skills too. So it's a good opportunity for that. So,
Okay, so I just think we should just start with the basics. So I'm a part-time faculty member, newly hired on, don't really have a clinical assignment in the semester, but want to work in the Learning Lab. How do I go about signing up for that?
Well, first they can just reach out to me. They can email me. So it's just brandon.dominguez@rcc.edu, and then just express their interest to me with that. We do go by a bit of a seniority when it comes to making these assignments. So we have some instructors that have just joined us and been with us for maybe only a few weeks. And then we have some that have been with us for years. So when the schedule comes out, or when I develop that, we'll find out how many slots are available, how many people we're looking to have, and then I'll make that schedule according to seniority. But some people might feel a little bit like they might not be able to get a shift. So they're like, well, what's the point of even trying? You know, there's so many people who have been there for so many years, but it's always good to still sign up anyways, because just like any other job, there's going to be times where people say, I can't come in, I need to go pick up my dog from the groomer or whatever it is. So we're always needing people to cycle in and out. And we will have students sometimes, or previous students that graduated 3-4 years ago, that join us, and they're picking up shifts all the time. So if that's something that you're interested in doing, something you want, just reach out to me, email me. I can put you on our list and get you started with maybe even if it's just one shift or a few hours, something like that. It's always good to just kind of just try it out and just see if you like it or not.
Yeah. And that's kind of what I tell our faculty when we hire them on too, is, try out the Learning Lab. We do have things that come up during the semester. We started with our med intensive and the retesting of students. And so I know we have like different needs that come up during the semester too. So thank you for that information. So once a faculty is signed up in the Learning Lab, what does that role look like? So how do we onboard them? What are they expected to do when they're there?
I like to tell faculty members you're much more of like a mentor in that position, right? Because we're having students from all over our program going to this learning lab, or kind of think like a skills library is another way to think about it. And you're really that point of contact for that person or that student to really learn how to practice or hone these skills. So I think a big part of that is being able to be that resource live in person, and really thinking about what's the difference of the student like accessing the internet and just going to YouTube and looking at the video, because a lot of people do learn through just looking at YouTube and videos. But let's take advantage of the fact that I have a licensed person here in the Learning Lab, and I can use them to actually help verify my skills. And that's actually what a large part of what the job is too, is being able to go and verify those skills and make any corrections if needed for that. But more importantly too is to be able to sometimes, for those instructors, depending on their specialty, to kind of give their own perspective on the skill. Or, here's how we do it for general med surg, but you had mentioned to me that you're interested in pediatrics, and here's how it would be done in peds, or here's how it would be done for OB or whatever, ICU, whatever the specialty is. So it really does give students a much broader perspective to be able to have that Learning Lab faculty member there to see it from that specialty point of view sometimes, or even if it is just the generalist or the nurse that practices med surg, there's still so many opportunities for that student and faculty member interaction. So that's a big thing that we really try to push towards our Learning Lab faculty members, is to do that. And we're developing more of an onboarding guide right now, and we're trying to do more resources for both the students and the faculty members. So one thing that we'll actually be launching this fall is going to be a website for faculty members and students to be able to visit and be able to learn about all the different equipment that we have, and it has tutorial videos on there, and there's even little mini case studies that revolve around specifically that equipment. So that'll be just rccsims.com. So you can actually check it out right now if you have the time. So check that out, rccsims.com, to learn about all of that stuff, because it can feel really overwhelming. You know, you're a new faculty member coming to the lab,
right,
and we have this supply closet, and you walk in there, it's like, oh my gosh, there's all these shelves, there's all these hidden compartments everywhere. Like, do I have to know all of this? Like, well, you don't have to be a master of the equipment, but there's nothing wrong with just saying, hey, I've never done virtual reality before, but we can learn this together. Like, let's sit down here and we can walk through. I can help give you the nursing context to it, but let's learn this piece together. And then again, that's that website's supposed to be, is given that opportunity for the student and the faculty member to check it out ahead of time, learn how to use, whether it's high tech like augmented reality, virtual reality, or some of our lower fidelity like our skills trainers, where it's like a piece of silicone that the students could use to practice injections, for example. So
okay, perfect. That's exciting. I'm excited to see that, because I think equipment and resources change a lot, and so we need to kind of stay up with that. So I know they're going to really appreciate that.
Yeah, I'm excited because we just recently got through a grant some Apple Watches, Galaxy Android watches. We got some new continuous blood glucose monitoring system. So all these things that we're seeing trend in healthcare, my hope is that we can have that on a regular rotation for students and faculty members alike to see, okay, Apple Watch hasn't hit our textbooks yet, but that doesn't mean that it doesn't exist out there, right? And as a nurse, like, what should I be educating my patients on and how they could use that, or the benefits of the device like that. So even for, again, faculty members that may not be seeing that, because if you're in the ICU, you're probably not seeing or helping patients with their Apple Watch, right? So it still gives them an opportunity to learn what the technology is, and then how they can be used in like the healthcare context too. So for all of those devices, all of the equipment that we have, it's hopefully will be a great resource for the students too.
Right. And that's great. And it really, I appreciate that, because it really speaks to our curriculum when we talk about innovative technology, and we're trying to advance our students with that evidence-based practice. And again, it's not going to hit the textbooks for years, but it's still out there. So we need to know how to use the equipment ourselves, and then how do we translate that to the students so they know how to use it.
And again, as a faculty member, imagine coming in there, you're seeing this technology, maybe you don't use Apple Watches or Galaxy Android watches, you don't use that, and all of a sudden you're having a student that's like, can I practice this equipment? Can you help me with this? It can feel intimidating. So again, hopefully to help bridge that gap, that let me just freshen up on what's trending in healthcare, what's some of the equipment that the students are going to be asking for. And it kind of just, I think it'll just be good overall, but a better experience for the instructors and the students. So.
Great. Okay. Well, thank you for that. So kind of talking about the students. So we have, of course, all of our different programs in the School of Nursing. So as a part-time faculty, what kind of students can they expect to encounter in the Learning Lab?
You're going to experience the best students. Let's tell you that.
Well, that's perfect.
So the best students here at RCC, but specifically what disciplines? We'll be seeing students from our Certified Nursing Assistant program, our Licensed Vocational Nursing program, and our Registered Nursing program. And we might even start seeing more from our Anesthesia Tech program as well. So you're going to be seeing those from all different of those disciplines and all different skill levels within that. So our CNA program, we actually have a few different programs within our Certified Nursing Assistant. So not only do we have our basic 16-week program, but we also have like an acute care program. So it's possible that if I'm an instructor in the lab, that I might be getting a CNA student come up to me and asking me specifically about how do I operate as a CNA in that acute care environment. So that's something that's pretty special to our programs here. And then our LVN and our RN programs, you can get students from there too, whether it's their first semester in the program. So just how do I give a bed bath? How do I make a bed while someone's occupying the bed? So it could be something simple like that, all the way up to some of our more advanced students that are looking at more of managing chest tubes or managing central catheters and how to administer medications through there. So it's really quite a range of students from fundamentals all the way up through our advanced medical surgical skills as well.
And so with that, I know we have a lot of forms in the School of Nursing. What type of documentation might the faculty be presented with that they need to sign? Because I know a lot of times students will come up and say, hey, can you sign this for me? And they're not sure, well, can I sign it? Can I not sign it? So can we talk about that just for a minute?
Yeah, sometimes students can get a little maybe inventive, or I should say, they get a little bit anxious, I guess, sometimes when it comes to fulfilling all of their requirements. And sometimes fulfilling those requirements and getting signatures like some of our documents require, it doesn't really cross their mind till like the very end of the term, which is probably not the best time to do that. So what ends up happening, and I think this is probably more of a common concern that I think some of our more seasoned lab faculty members have, is very much like what you just said, is students coming to me at the end of the term and they want me to sign off all their hours, and this hour sheet lists all the skills that they're required to do, and they're supposed to have an instructor sign off that, here, I observed you doing the skill, so I'm going to sign off that you're at that appropriate minimum skill level for that, right? So sometimes the students will bring those forms at the very end and say, can you sign off my whole sheet? So that's something I would say, like, we're not doing that, right? We're not completely signing off everything. Of course, if you didn't see it, you didn't check the skill off, you weren't there in the lab while the student did it, then we're not going to be signing off those hours or those skills for that. So what instructors will probably see the most are the hour verification forms. So we have various lab classes that students could sign up for. You'll typically hear it in like a number followed by like A, B, or C, and then each of those courses has so many hours that the student has to fulfill. Now, most of the time, I would probably say if not all of the time, we have an automated system. So a student will walk in, they'll put in their ID number, and that automatically tracks their hours. But as far as skill verification goes, that's what really the instructors will probably see the most. So it'll probably be from the CNA students the most, because we really try to mirror the expectations of when they go for their skills exam in person. This is what it looks like. This is how you'll be tested. So our program, we have those students check off just like the state would for those skills and have to walk through it step by step. So we do have a lot of those CNA students coming through our lab and asking those instructors for verification and signature. Did I do this correctly? Did you see me practice this? So that's probably some of the more common forms that I would see. On a rare occasion, you might get a student that comes up and says, I don't know, there was a strange lightning storm and the computer didn't record my data correctly, but I remember you were there with me last Wednesday, but it didn't record my hours, so can you please just sign off showing that I was here? So that's okay. That stuff like that's fine. But when they're asking you to sign off things where you weren't there or skills you didn't observe directly, then I would probably just recommend the student try to find that instructor who was there during that time. And if not, if the student's like, I've been trying to track them down, I can't find them for whatever reason, they can just refer that request to me, and then I can kind of help them resolve that problem.
Okay, that's good. Because I know, a lot of times students will, if they can't find, the person in the lab, or if it's in between the lab time, they'll come down the hall to the office and they want us to sign off like a competency form where they're doing retesting, and it's like, no, we can't do that. So I'm glad you'll clarify it for the faculty that if they didn't observe it, they should not be signing it, and then any issues they can refer the student. The next question I was going to ask, and it's kind of really the last question, is, our simulation program is really booming. We're nationally accredited in simulation, and we're one of the only schools, I believe, in the state of California for a community college that has that national recognition. So we're really innovative in our simulation, and I know you're really into the virtual reality and the augmented reality, and we have all of that new technology. So if I'm a faculty member that wants to get involved in simulation, what are the requirements? Can I just go do a simulation with the semester level, or do I need to have a specific type of training behind me?
Yeah, so there's definitely a component to like cross-training that you would like have in the hospital, right? I wouldn't just be a med surg nurse and then I'm going to float to OB, right? There would have to be some type of training or some type of skill verification or something to do, right? So same thing when it comes to here. Like if I want to participate more in simulations, what can I do? So we have what's called this School of Nursing Simulation Collaborative on Canvas, or learning management system. There's a special course that all faculty members will have access to.
Okay.
And within there, we have a certification module that those new faculty members can complete that just talks about the basics of what does proper debriefing look like? How do I facilitate a simulation? What are some important guidelines to have? Because we've probably all been through simulation at some point in time through our education, but it is a little bit different when it comes to facilitating yourself. So what it would typically look like is if a faculty member was interested, I'll direct them to that part on Canvas. They work through the modules on there. They complete that component of it. And I would try to set them up to shadow at least another instructor who's already currently doing simulations. So have that opportunity to kind of just take that back seat and just observe and see how that works. And then we can start scheduling them to start doing more of them on their own. Some faculty members probably feel a little bit more comfortable doing more of the fundamental simulations. Like we have one that's just doing a head-to-toe assessment. So if I have a new faculty member that comes to me, I'll try to put them in with our N11 or starting VM program and just say, this one's rather simple, it's straightforward. Let's have you start here. Get some practice with it, and then if this is something that you enjoy, something that you want to keep continuing with, there's a couple different avenues that we can go. We can start placing them with other terms, and there's also more educational opportunities. Many of our faculty members are actually already certified healthcare simulation educators, which is like a post certification that you can get that just focuses on simulation. There's some that are in progress to get that. It's not necessary to have a CHSE to do simulations. It's just a standard that we uphold for our accreditation to show that we have these people who know what they're doing in simulation. So if that is something that you want to do for yourself, I can also help point you in the direction of that. We have a lot of resources here in the community college district to help new faculty members learn how to do simulation and to follow that pathway for certification afterwards too. So many opportunities. It's definitely not just a place for you to come and teach. It's definitely a place for you to come learn and keep growing your own skill set too.
Absolutely. It absolutely is. And I appreciate that. Being part of the simulation program, the accreditation when it first came out is really exciting. And you're right, it can be very intimidating if you don't know, but we have resources to get faculty onboarded appropriately and get them kind of up to speed with all the technology.
Yeah, absolutely. We've got a lot of different avenues for that. And again, it can look really intimidating, especially when you start looking at some of the cost behind the equipment. I think that scares some faculty even more. Like we have a really interesting simulator for our OB that will actually give birth to another mannequin. And when you look at that, you're like, oh my gosh, I'm so afraid to even touch it.
Right.
We have other simulators that will sweat. They can simulate stroke. They can move their arms with robotics. So it looks really intimidating, but once you just break it down and just learn a little bit about it, that fear kind of goes away and we start getting a little bit more comfortable with it. And in turn, we can really help our students out with that too.
Right.
And because they're going to be the people and the students who are practicing that in that simulation. So being able to know more about it overall makes a better learning experience.
Right, especially when they realize that it really does affect patient outcomes at the bedside. Giving students that experience can help them when they get into practice go, hey, I did this in simulation and this is what the outcome and this is what I did. So
yeah, and simulation is not meant to replace direct patient care hours. I think that's a big myth that I still hear a lot of people say is that I'm totally against simulation. It's best to just have all of your hours at the bedside. I'm like, I agree. It is best to have all of your hours at the bedside or you have the best experience at bedside as possible. But there can be a bridge in between textbook and touching a person in real life or doing this skill in real life, right? And that's what simulation is supposed to be. And we have a whole spectrum of different activities that we can do to help that learner really start getting the confidence. So that way when they're in person doing the skill, at least they have the motor skills down. It may not be the soft skills of, okay, can you please turn over? I'm going to put this needle inside of you now. Like that'll take some practice, but actually feeling the resistance of the needle with things or just getting used to handling handling the medications. Because when you're in a real person's room and you're trying to hang a piggyback and the machine starts beeping at you, you start getting really anxious. You're like, oh my gosh, I can't do this anymore. Like, I'm just so worried that I'm going to do something wrong. And that's, again, what simulation is supposed to do. I've heard the beeping of the machine before. I know how to troubleshoot the machine because I've practiced it in simulation. I'm getting some type of other technical issue with maybe the syringe pump, or maybe just the syringe itself, or anything like that. It's more of a practice opportunity. So
yeah, and it's great. And when we look at our, at the end of every semester, as you know, we do course evaluations, and students love our simulation program. They feel that that's where they really kind of learn during that debriefing period, because we know that's when a lot of learning occurs. So having our faculty that are trained and feel comfortable and doing that piece, I think is going to be a big asset for our students.
Yes, it's definitely its own art form.
Yes.
Teaching is its own art form, and then even simulation inside of that is its own too. And if you feel like you think this is something you can do, I think you'd be even more surprised at looking at all the theory behind it and looking at how you can be even more effective with how you facilitate your classroom and in a simulation setting. It's really amazing, like how much there is behind it, how much science and evidence-based practice goes into all of this. So from the outside, very superficial level, oh, here's some nursing students playing with a doll. It's definitely not like that.
Right.
It can look like that from the outside, but there's very much an intent and purpose behind it. And we really, again, being one of the very few accredited schools in the nation, let alone California, at this level of nursing, we really try to uphold that excellence. And it is something that we do expect of our students and, in turn, of our faculty members as well.
Great. Well, thank you. And it shows. It shows. So that's actually all the time that we have today on the Pulse Point. Dr. Dominguez, thank you so much for joining me. Please, part-time faculty, if you're interested in working in the Learning Lab, reach out to Brandon, and he will help you get signed up for that so you can start facilitating these awesome experiences for our students. And next time, please tune in, because I'm going to have Miss Allison Wright, who is our clinical coordinator, come on and talk about clinical onboarding for our part-time faculty. So thank you so much, and thank you for joining us.
Don't be a stranger. Say hi.
Say hi.